everyone. I am Dr. Uday Kumar from Portia Medical, and today we'll be talking about the elderly population in our country and its impact on healthcare. The number of people who are growing old is growing exponentially in our country, and then it is important for us to add not only years to their life, and it's equally important for us to add life to their years. Let me give you some of the statistics of the elderly population in our country. By the year 2050, it is expected that there are 300 million, or in other words, 30 crores of people who will be considered elderly. Amongst these 300 million, there will be 200 million, or otherwise 20 crores of people who are expected to have a chronic health disease or a set of chronic health diseases. What is more alarming is that 1/4 of these 200 million will be requiring medical care, hospitalization and so on. Therefore, you can imagine the number of people who will be ill by the year 2025 to 2050, and we are not at all prepared to handle this kind of a load of patients and elderly population if you do not plan for it now. Now let us look at the financial implications and the insurance costs of this burgeoning elderly population. I am talking about costs incurred in a lifetime in this elderly patient. Now let me show you a graphic. If I take an example of the United States, you can see in this particular graphic that most of the percentage healthcare spending by age is in the elderly population. For example, in the 65 to 84 age group, almost 60% of the healthcare spending goes there, and once a person touches 85 years or more, 80% of the costing of healthcare is channelized towards that area. Therefore, cost becomes a very important criteria in healthcare delivery. Young India is no longer young. It is a myth to say that India is a young country, because within no time you will have an explosion of senior citizens in the horizon, and by 2050, like I said, we are expecting 300 million elders to be with us. Now this is because we have adequately managed to control all the acute illnesses, and all these people are prone to developing chronic healthcare problems as they get older. For example, as you can see in this graphic, in the year 2000, the population was 1000 crores approximately, and this population is going to touch 1500 crores by the year 2050. That means there is going to be a 1.5x increase in the population. But this gets more interesting if you look at the age of 60 plus. From 76 million in 2000, it is expected to touch 324 million by 2050. So the jump in this particular subgroup of population of 60 plus will be 4 times more. It gets even more interesting once a person crosses 80 years. In the year 2000, if the population was 6 million, by 2050 it is going to touch 48 million. Therefore, commensurately the increase in the number is going to be 8x. Therefore, you can see the explosion of elderly by the year 2050. Now let me give you some of the challenges the elders face with time. There is a changing norm, the way people are living their lifestyles today. The number of people or number of children a person has is less, and the children may not necessarily be with the patients. They may be working in a metropolis away from the patient's home. Therefore, the number of people taking care of this particular elderly population may be reduced. There is an epidemic of chronic healthcare conditions. We have managed to contain all the acute illnesses, but the diabetes of the world, the hypertensions, the cancers and the dementias, etc., are hitting the roof in terms of afflicting the elderly population. And very unfortunately, healthcare delivery is so uneven in the country. There is very efficient healthcare in major cities and metropolis, but as you go down to tier 2 cities and the towns and the talukas and the villages, the healthcare system drastically falls. Therefore, this skewed healthcare contributes to a challenge for elder care health management. Now, what are the most common healthcare conditions encountered by the elderly? Like I said, it is no longer infectious, but the chronic healthcare conditions like diabetes and hypertension take the upper hand. As you can see in this graphic, I have enlisted some of the common healthcare diagnoses of patients, and the disease profile is hypertension, heart disease, diabetes, chronic obstructive pulmonary problems, arthritis, cancer, dementia and stroke. They are all at best controlled, cure very rarely, and therefore the patient dies with this particular problem. There is also a condition called end of life care or palliative care, which is encountered during the terminal phases of a person's life, during the end of his illness. It may be cancer, it may be stroke, it may be diabetes, and most people prefer the end of life care to be delivered at home and not in hospitals, and it makes sense because this is not going to be a one-stop shop and it's a prolonged situation. Therefore, this particular segment, end of life care or palliative care, is very poorly understood as of now, and there is going to be a need for this particular sector of healthcare delivery very urgently. One of the solutions we can provide for this population of elderly who are not doing too well from the health point of view is to enroll them in what is called a home health care plan. This plan envisages mapping the symptoms and the problems this particular elderly person has and finding out what we can do proactively in terms of a doctor visiting the patient, a nurse visiting the patient, any lab tests required, and at what periodicity a healthcare worker is assigned to this particular patient to interact with this particular person to find out what delivery of healthcare can be given, what symptoms which he or she has acquired recently, and what is the treatment plan delivered as a particular package to this particular elderly person. Therefore, proactively we monitor their health condition, we make sure that adequate medical resources available to them, adequate medications are available to them, and at periodic intervals adequate blood tests are conducted on this particular population. This is called a health care plan, which we can devise as an individual health care plan for each particular elderly patient. The problem all these years has been in healthcare has been scalability. See, a doctor can take care of set number of patients in a particular vicinity in and around his clinic or home. But if you want to have a project which will encompass the whole population of a city or the whole country for that matter, you require scalability, you require technology to monitor, you require various mechanisms as a backbone to deliver the system flawlessly day on day, month on month, year on year. Therefore, a happy marriage of technology, of adequate personnel, of various parameters like this will make an efficient healthcare system for the elderly and deliver the optimum care required for this population. Today, the hospitals are finding it extremely difficult to manage with these chronic ailments once they are controlled, because it is very difficult for either the hospital to monitor the patients at the hospital periodically or for the patients to visit various hospitals periodically to get their medical checkups done. Therefore, a happy marriage between a home healthcare system and a hospital is the order of the day. It's very heartening to know that hospitals are reaching out to various home healthcare organizations so that out of hospital care can be delivered by these organizations at the patient's home, and the liaising work between the hospital doctor and the home care doctor can be done, and if in case there is an emergency, the doctor can shift this patient to the hospital, and if in case it is not such an emergency, telephonically the doctors can talk to each other and deliver absolute care. The bottom line is that the patient stays at home, gets the hospital kind of care at home, and the hospital functions seamlessly as far as they are concerned. The home care systems deliver these particular mechanisms of health care at the patient's home, and everything looks absolutely optimal if it works like we envisage it to be. In conclusion, let me say that the number of elders in this world, in our country India, is growing very exponentially, and we need to address it as urgently as we can. One of the solutions for this particular problem is development of a very robust home health care program. In a home health care program, these patients can be looked after in the confines of their home till the disease overtakes them and they succumb to the illness, and unnecessarily do not burden the hospital and the insurance systems and the financial systems, so that everything is optimally maintained and patient also leads a very dignified life in the confines of a home without having to go to a hospital every now and then. This is the way we need to look ahead and develop a robust home healthcare system, and a system which is technologically enabled, so that day on day, year on end, we will be able to provide the same kind of care which the patient would otherwise have got in a hospital. Thank you very much. This is Dr. Uday Kumar Maya from Portia Medical.